As we work through the increasing case numbers and manage through this fifth wave and the very contagious Omicron variant, we want to ensure that our staff and physicians remain safe and healthy so that we're able to provide care to Albertans when it's needed. This has and continues to be our very top priority. Together with our union partners, we developed an initial joint statement on personal protective equipment very early on in the pandemic in March 2020. We then updated it in February 2021. We have just updated it again, and this is what I'd like to speak with you about today. On December the 23rd, Alberta Health Services, along with the Alberta Union of Provincial Employees, Covenant Health, the Health Sciences Association of Alberta, and the United Nurses of Alberta, updated the joint statement on the safe and effective use of personal protective equipment as part of our collective response to this pandemic. The updated joint statement reflects guidance from the Public Health Agency of Canada. It reflects our desire to simplify our PPE guidance, and it also reflects our clear understanding that this pandemic is dragging on, our workforce is tired, and we need to protect both the mental and physical well-being of our staff and physicians. The updated PPE joint statement provides clear guidance and emphasizes minimum PPE requirements for specific patient encounters. We trust and have confidence in our workforce. This updated statement also provides all frontline professionals the authority to make decisions about the personal protective equipment that you feel is necessary for your protection, based on your professional judgment and your point of care risk assessment, the nature of the patient, what you're planning to do, and the environment in which you're working. I'll give a brief overview of what's in this new joint statement. All clinical and non-clinical healthcare workers who are within 2 meters of a patient suspected, presumed, or confirmed to have COVID-19 are to wear a fit-tested N95 respirator or an approved equivalent, together with gowns, gloves, and eye protection. In settings with a high density of patients having COVID-19, or where there may be frequent or unexpected aerosol generating medical procedures, for example, in an emergency department, or a critical care unit, or a COVID-19 unit, or a unit experiencing an outbreak of COVID-19, in those sort of settings, all clinical and non-clinical healthcare workers are to wear an N95 respirator. Fit-tested and seal-checked N95 respirators must be used in rooms where aerosol-generating medical procedures are being performed. For all other healthcare delivery, there may be situations where a healthcare worker, based on their point of care risk assessment of all known and foreseeable hazards, may also choose to wear an N95 respirator. Finally, if a healthcare worker, based on their assessment of all known and foreseeable risks and hazards, determines that it is safe to wear a medical mask instead of an N95 respirator, they're also able to do so. It is critical that all of us continue to follow the PPE guidance in place to reduce the spread of not only COVID-19, but also other respiratory viruses. While getting your COVID-19 and influenza vaccines are key, additional layers of protection, including meticulous use of PPE, donning and doffing practices, and staying home when you're ill, no matter how minor your symptoms might be, all work together to protect us and to protect patients. Completing fit for work screening every day, washing your hands consistently and regularly, and physically distancing as you can, and particularly in common rooms and break rooms, this can all help to protect you and your colleagues from illness. We thank our union partners for their collaboration and their efforts on this updated joint statement as we continue to work together to protect our staff, our physicians, and the Albertans that rely on your care. We thank everyone for their patience as we continue to make appropriate updates to supporting tools and resources to align with the updated joint statement. If you have questions about this updated joint statement, we encourage you to review the supporting guide and other information that is available on Insight.
Together, we do amazing things every day.